My name is Dr. Peter Boothman. I'm the new Mohs and Cosmetic Surgeon here at Ada West Dermatology. I am a board-certified dermatologist and a fellowship-trained and board-certified Mohs Surgeon and a fellowship-trained cosmetic surgeon. I did my training for medical school at the University of Washington in Seattle, then completing my internship at Spokane Teaching Health Clinic in Spokane, Washington, before completing my clinical trials research here at the University of Alabama-Birmingham, as well as my dermatology residency at the University of Alabama-Birmingham. I then did a Mohs Surgery fellowship at Surgical Dermatology Group in Birmingham, Alabama, with Christopher Harmon, one of the highest volume Mohs practices in the country. I then did an extra year of cosmetics training at Clinic 5C in Spokane, Washington, under the direction of Cameron Chestnut. So I'll be providing primarily surgical options for the patients at Ada West Dermatology. Initially, mostly medical, but over time we'll be doing some cosmetics as well. I joined Ada West. That's a great question. So the history there was that my partner, Dr. Ryan Thorpe, when I was a third-year medical student, which is when you go to the clinics and go on the wards, they call it. The first day I showed up in my little white coat, the very first doctor that was assigned to me as a new doctor was Dr. Thorpe. So I got to know Dr. Thorpe over the years. He was going in to be a Mohs surgeon, which I am also. He kind of helped me on that path. And then over the years, we stayed connected. That was my initial connection to Ada West. And then when I was looking for places to land, I wanted to join a really stellar practice, one that was striving for excellence, one that had a vision to be the best in our region, and also one that just kind of had a heart of service for the Northwest, which is where I'm from. And so I think Ada West is a great fit for all those things. And I just really bought into their vision of what they want to do for the future, which is why I decided to join them. Yeah, so I've done a lot of different types of research. I spent an entire year as a clinical trials research fellow. So I was involved in a huge number of actual clinical trials. So I was the doctor that was administering new medications that were in trials. So very experienced in all the psoriasis medications. We did different medications for eczema, for alopecia areata, for vitiligo, for skin cancer prevention. So that mostly my research focused on the clinical trial side. I've also just been involved in just some presentations, talks, and kind of ancillary papers, things of that nature that I've published throughout my career. You know, being a Mohs surgeon is a great combination of right brain and left brain, because on the one hand, you know, there's the science. We're taking off skin cancer. We get to look under the microscope and kind of see what the cancer is doing and keeping everything as small as we can while giving people the highest cure rate. That's awesome. But the flip side is you get to be a little bit of an artist and you get to be creative with restoring people back to look as normal as you can. And, you know, that's a big passion of mine, is that we're melding both the medical and the cosmetic to kind of bring people up to the next level and hopefully, you know, give people the best outcome that we can. A question we get often is, what is Mohs surgery? And, you know, Mohs surgery is just named after a doctor, Fred Mohs. What it really is keeping the cancer spot as small as we possibly can and using the microscope to guide us removing it. So that does two very important things. It gives us the highest cure rate that we can. Most cancers, it's upwards of 99%. It also keeps any defect when we remove the cancer as small as we possibly can. And I think that those are two really important things when we're dealing with a cosmetically sensitive area, such as your face, which is where a lot of the cancers are on the head and neck. So I think that's a great thing about Mohs surgery, is that we can, a big thing that I wish people knew better is that when you walk out the door, your cancer is gone. We already know that. And that's a huge relief to a lot of people. The field of dermatology is awesome. It's been on the cutting edge of a lot of things for many years. I think that in the field of dermatology, we're the masters of immunology. And so you'll see a lot of new biologic medications coming in. I think in the field of Mohs surgery, I think you'll just see it be more and more adopted. I think it's really become the gold standard for skin cancer treatment. I think that you'll see melanoma being treated with Mohs surgery more and more over the coming decades. I also think that you'll see dermatologists doing a lot more of the surgical reconstructions. I think that, dermatologists really coming into their own and Mohs surgeons in terms of doing not only Mohs surgery, but also really good reconstructive dermatologic surgery and cosmetic dermatologic surgery. So I think those will be big trends you'll see. On the point of things that are changing, specifically in the cosmetic dermatology space, I think what you'll see a lot is over the last, couple of decades, we've seen the advent of a lot of fillers. And filler is a gel substance with different types of viscosity that you can put into your face. In the outpatient setting, generally speaking, it's relatively safe in the right hands. It's also pretty inert. And so I think a lot of people have been using filler for a lot of things. And sometimes that can also get a little bit out of hand. So over time, filler, I think there's a misconception that filler dissolves over time. I think what it really does is lose its structure, but it's still in your skin. Particularly when we're doing surgery, we can find filler in all different spots that people had filler more than a decade ago and it's still there. It's lost its ability to maintain its form, but it's still in the skin. So a lot of times what we have found is we'll be doing filler dissolution and revision because sometimes, you just get that look, and I think we've all seen it, where you just look a little bit off, and this is a whole subcategory of things to talk about there, with perception drift and also understanding the aesthetic of your injector and choosing the person who has a natural look versus someone that's, potentially has a very unique aesthetic. And so all these things are things to consider when you're getting filler. A lot of what I see in my practice is helping people dissolve filler, and we have some good techniques on how to do that. And it's an exciting thing to bring to Ada West. When I think about a good skincare regimen, there's 4 basic components. You got to have a good sunscreen. You got to have a good vitamin C. You got to have a good moisturizer, and you have to have a good retinol or retin A prescription product. Those are the 4 basic components that everyone needs in the skincare. Yeah, so we're new to the Boise area, so we're discovering kind of the great outdoors. We're definitely outdoors people. I grew up in Eastern Washington and kind of grew up hiking and camping in the Cascade Mountains. So I grew up playing basketball. When you meet me, I'm a big, tall guy, you'll see. So I never grew up skiing. So we've been learning how to ski up at Bogus Basin and kind of around Idaho. So that's one of the things that we do in the winter. And then in the summer, we do a lot of biking and kind of hiking and outdoor activities. It's what we really enjoy doing. We also just kind of enjoy hanging out with my family. I have a wife and 4 kind of small kids, so that's a big part of my life at this phase. And everything that entails in suburban youth sport life. My journey into medicine, and I think into this profession, in terms of my background, I'm from a family in Eastern Washington called the Dornick family. Some of you may know my uncle from the 1970s and 80s. He was a Hall of Fame running back at Washington State. But my grandfather was a rural family physician in Yakima County on the Yakima Indian Reservation in a little town called Wapato, Washington. So I grew up a combination of 2 things. My family has a big in Washington, we call it a fruit ranch. So we had my extended family had a big farm. And then my grandpa was the local small town doctor, kind of in a very rural setting. So kind of how I grew up was a combination of farm life, mixed with sports and mixed with kind of a family that was in rural family medicine, which is very much what Idaho is like. So that was kind of my early influence into wanting to become a doctor. I grew up working on the farm every summer, working hard, understanding just kind of the plight of farm workers and just the life that it takes to be a hard worker in our culture. Along those lines, and this really inspired me to the heart to serve kind of people in the Pacific Northwest. And throughout medical training, I had a number of mentors along the way. Like I mentioned, Dr. Thorpe when I was a medical student. Just honestly countless people that have helped me on my journey. And and I really just found that my skill set best involved dermatology and Mohs surgery. So I wanted to come back to the Northwest to help folks, and I'm excited to serve the people of Idaho. I think something that would surprise people about me is that I'm a total history buff. If you come talk to me, I'm kind of a trivia master of random things. Yeah, I think that I don't know if it's surprising to people, but I just have met a lot of wonderful people and patients over the years, and it's really fun to connect my love of history with real time with people. That's a fun thing about a Mohs surgeon is that we get to, we oftentimes get to talk with people while we're doing our procedures, stitching stuff up, and I just really enjoy that kind of conversation and getting to know folks, but also I've just learned a wealth of knowledge from my patients, which has been really awesome. Yeah, so I'm from just a large family, and probably our favorite family tradition is we have a huge family reunion that we rent an entire conference center up in the woods at Memorial Day weekend every year. When it first started, I was the newborn baby. So it's been going on for 30-something years, and we go back every year, and we have all these fun traditions and a lot of cousins, and spending time with no cell phone reception in the woods for a weekend is something I'd recommend for everybody.